Good day, my name is Yusuf Hamad, and today I'm pleased to present to you a summary of my EM 600 paper, which is titled Health Impact Assessment of Particulate Matter 2.5 Pollution in Saudi Arabia, and this is a policy analysis. To start this presentation, in 2016, the World Health Organization estimated that about 7 million deaths worldwide were attributed to air pollution. And this makes air pollution the fifth leading cause of global mortalities. And out of more than 3,000 cities studied by the WHO, 3 cities in Saudi Arabia were ranked amongst the top 15 most polluted cities in the world. And this is in terms of particulate matter. Those cities are Riyadh, Jubail, and Dammam, with levels more than 10 times the World Health Organization recommended standard. And in fact, a recent study estimated that life expectancy in Saudi Arabia is reduced by 1.5 years due to particulate matter 2.5 pollution. So the question is, what is particulate matter? Particulate matter refers to a mixture of particles that are suspended in the air, and those are divided based on their size. The first type is PM10, or particulate matter 10, and this refers to particles that have a diameter that is less than 10 microns or 10 micrometers. And to put it in perspective, this refers to the diameter of a human hair. The focus of our study today is PM2.5, also known as 5 particles, and those are the particles that have less than 2.5 microns in diameter. Those particles are mostly attributed to vehicular and industrial emissions as opposed to PM10. And the problem with these particles is that they are so fine that they could travel deep in the respiratory tract and cause a lot of adverse health outcomes. Because of that, and due to the enormous amount of research done on them in the past 20 to 30 years, the causal link to mortality has been generally accepted, and many of the environmental authorities around the world have already established certain guidelines based on the mortality link that has been established through research. The issue with PM2.5 is that they are very rampant in industrial and large cities due to the concentration of people and activities. And when looking at Saudi Arabia in particular, there are 2 major sources of PM2.5 in Saudi. First is that Saudi Arabia is amongst the top 3 oil producers in the world, and in addition it has established several industrial cities since the 1970s, which served as a backbone of the petrochemical industry that is taking place today. And this resulted in a lot of emissions that contributed to the increase in PM2.5 levels. At the same time, Saudi Arabia is mostly an arid land with minor vegetation cover and very low rain averages. This contributes to lots of particles to continue to suspend in the air. Add to that the occurrence of several dust storms throughout the years, which elevates the level of PM2.5. Now, with that in mind, our motivation in this study is translated in the definition of the health impact assessment. The health impact assessment is an established method for estimating health costs and benefits in relation to air pollution policies in general. When it is done retrospectively, it informs about the effectiveness of these policies to the policymakers. So looking at it from a cost-benefit analysis. And on top of that, there has been a lack of published studies of the health impact of air pollution policies in Saudi Arabia. There is very limited number of studies, and only the Global Burden of Disease study have looked at this in separate times and has identified health cost that is in excess of $30 billion in Saudi Arabia in 2013. in relation to mortalities associated with particulate matter pollution. And to our knowledge, there has been no published study that estimated longitudinal health costs or benefits in relation to PM2.5 specifically in Saudi Arabia. With that in mind, what we will do and what we will aim in this study is to retrospectively quantify all the health costs and benefits of PM2.5 exposure in Saudi from 2004 to 2017. In addition, we will assess the benefits of a national policy if implemented on PM2.5 until 2030, and this is to align it with the Saudi 2030 vision, the ambitious program that the country has undertaken to transform its economy. When looking at the literature available in regards to PM2.5 research in Saudi Arabia, there has been lots of activities to measure the PM2.5 concentration and look at its sources. Some of these were in Riyadh in 2006 to 2007 and identified a concentration in between 76 to 189 microgram per cubic meter of PM2.5, and the higher concentration areas were near industrial areas. To put this also in perspective, the World Health Organization recommended standard as 10 microgram per cubic meter, and this is the level under which there hasn't been significant impact of PM2.5 pollution on health, at least nothing that has been identified so far. So 10 microgram as the recommended standard. Another study in Riyadh identified that urbanization, increased construction activities, the rise in vehicles use, and population growth are the factors that resulted in the annual increase in air pollution in Riyadh. Another study has used satellite data to estimate PM2.5 levels for 7 cities from 1999 to 2011. What's very significant about this study is that it identified a consistent increase in PM2.5 across all of these cities, and at all times these levels exceeded the World Health Organization recommended standard. Jubail, which is a very industrial city in nature, had the highest estimated PM2.5 levels at 62.6 microgram per cubic meter. Now compare that with the level that was obtained in the other study. The level that was obtained in the other study is based on ground measurements of PM2.5 as opposed to the satellite data that has been used to estimate PM2.5 levels. The other study that was done in Jubail was based on ground measurements of PM2.5 and identified a concentration of about 79 microgram per cubic meter on average between 2007 to 2011. And all the annual averages exceeded the local and international recommendations in this study. And this shows the difference between satellite measurements versus ground measurements. A lot of studies have identified strong difference, and the ground measurement data was sometimes about twice as high as satellite data. So this should be kept in mind as we go ahead. Most of the source apportionment studies, or those studies that looked at sources of PM2.5 in Saudi Arabia, identified soil, fossil fuel combustion, industrial dust, and vehicular emissions, as well as sea sprays, as the PM2.5 sources, the majority of PM2.5 sources in Saudi Arabia. When looking at the regulatory status of air pollution policies in Saudi Arabia, the Basic Law of Governance, Article 32, the Saudi government stated that the state shall endeavor to preserve, protect, and improve the environment and prevent its pollution. Because of that, Saudi Arabia has established its own air pollution policies, and the environmental law that was established in 2001 gave the General Authority of Meteorology and Environmental Protection, the authority to issue and monitor the implementation of environmental rules. Therefore, the GAMIP, as we will refer to it throughout this presentation, has issued rules for implementation in which it set certain standards for a lot of pollutants. However, there hasn't been a specific PM2.5 standard. Generally speaking, they only had a standard for suspended particles below 15 microgram, which includes PM2.5. The standard that was set had an annual average of 80 microgram per cubic meter. And this is inclusive of PM10 and PM2.5. Now, normally, if PM2.5 is at let's say 60 microgram per cubic meter, PM10 is normally twice as that, because you've got more particles that are in the range of 2.5 to 10, and then you have additional particles from 10 to 15. So achieving that figure is somewhat hasn't been happening for the past 10 or 20 years. When looking at other areas within Saudi, the Royal Commission of Jubail and Yumba had issued its own air pollution policy, and that started back in 2004. In it, they established a standard for PM2.5, which was revised downward in 2015 to a maximum annual average of 15 microgram per cubic meter. So these are the situation with the regulatory status. One thing to note is that there hasn't been a sufficient amount of information from air monitoring stations, as PM2.5 is not monitored publicly in GAMIP resources or in the Royal Commission of Jubail and Yumba resources. So this presents a gap in identifying information relevant to PM2.5 exposure in Saudi Arabia. With that in mind, we'll go through the methods that we have used to establish or to base this study on. First of all, our main goal is to identify the monetized mortality costs. What we need to do then is to establish all the elements to identify the mortality costs. The first thing that we need is something known as the VSL, or the value of statistical life. What that refers to is the amount or the value that a society puts on an undefined life. And the way to measure VSL is to essentially divide the willingness to pay by the amount of risk reduction. There are two basic approaches to do this. The first is a revealed preference, and the second is a stated preference. A stated preference is basically going to people or establishing a survey and sharing it with people, asking them how much are they willing to pay to reduce their risk of mortality by a certain amount. And that value basically allows the researcher to define the value of statistical life. The other way is the revealed preference studies, which basically looks at the differences between salaries and the risk of each job, and based on it, they can infer the VSL. The thing about stated preference elicitation methods is that they give a lower estimate than the revealed preference method, because people tend to lower their perception of risk. What we have identified for Saudi Arabia, there was only one VSL study that was done, and it is based on road accidents. So this figure is based on a researcher asking people how much are they willing to pay to reduce their mortality risk from a road accident. The figure that was established is about 900,000 US dollars in 2015 money, and this translates into 3.36 million Saudi Arabian riyals. So this allows us to measure the monetized mortality costs. At the same time, to basically correct the figure for inflation, we took the inflation rate of Saudi Arabia in particular from the World Bank in order to enable us to move the figure with the year in which we're conducting the study. And finally, we need the most important factor, which is the amount of deaths that are attributed to PM2.5 in Saudi Arabia. To calculate that, what we need is first the cause-specific mortality rate. Since PM2.5 causal link to mortality is established for at least 4 diseases. Those are lung cancer, chronic obstructive pulmonary disease, strokes, and ischemic heart diseases. Those mortality rates were obtained from the Global Burden of Disease study, which is a major study that is done by over 3,000 researchers around the world, and it estimates the mortality rates for different causes, and these are published on a database owned by the institute that runs the study. So these are all publicly available information. And we've also obtained the official Saudi population from the General Authority of Statistics in Saudi, and these are available on their website. And then we have calculated the relative risk. And to calculate this relative risk, there has been an established function which is known as the integrated exposure response function. And what this does is it basically associates the concentration with the additional risk that a person would contract from this exposure. This was established throughout the Global Burden of Disease study, and it assumes that the concentration of PM2.5 in the air is the toxicity measure rather than the chemical composition. And it puts a baseline that is between 5.8 to 8.8 microgram per cubic meter as a level under which there is no additional risk. Then beyond that, there is an exponential function which is shared in the study itself, and it has about 1,000 inputs for each cause-specific mortality rate. So when all of these are combined, one could assess how many deaths are attributed to PM2.5 in Saudi Arabia. This leaves us with the last input, which is the level of exposure that Saudi Arabia has had in 2004 to 2017. It's worthy to mention that we've chosen those years in particular because in 2004, that was the first modern national census in Saudi Arabia to establish the population level. And at the same time, we had the level of PM2.5 exposure readily available. So we've used all of this data from publicly available sources to enable reproducing the data, basically, and allowing people to conduct the same research and obtaining the same results. So this was one of the main factors in driving selection of data to ensure that it is publicly available. So with these methods as they are, we're going to look at the results of the study. So looking at the results, what this figure shows is the level of PM2.5 concentration in the green line from 2004 to 2017. And it can be seen that the concentration has increased from about an average of 75 microgram per cubic meter to an average of almost 90 microgram per cubic meter, with a dip in 2014 and then a rise in 2015. This dip and rise, while it is not clear why it is happening, it can be attributed to the oil price decline in 2014 and then the beginning of the war in Yemen in 2015. At the same time, it can be also seen that the population has increased significantly between 2004 to 2017, from roughly 22 million to about 31 million, and this represents almost 50% increase during that period. So our analysis, which is based on combining all of the mentioned methods and aggregating the lives lost for each year in one central estimate, reveals that almost 127,000 lives were lost due to PM2.5 high levels in Saudi Arabia. The 95% confidence interval is between 84,000 and 170,000. In addition, the monetized cost, which is based on the VSL multiplication by these lives lost, reveals that the monetized cost during that period, after adjusting for inflation, would result in 132 billion 2018 US dollars. This underscores the significance and the importance of establishing a national PM2.5 policy in Saudi Arabia, as the costs are of high magnitude and extremely severe in terms of the deaths and the lives that were lost due to PM2.5 pollution in Saudi Arabia. Now, to essentially establish a national health policy, looking at the World Health Organization air quality guidelines is a point to start from. They have recommended a certain number of policies. It starts with Interim Target 1, Interim Target 2, Interim Target 3, until you get to the air quality guideline, which is about 10 microgram per cubic meters. And those are based on years of mortality studies in which these levels were established. So in recommending a policy, we'll use these recommended targets to establish what would be the best recommended policy for Saudi Arabia. So what we will do is that we will assume that these were happening from 2004 to 2017 and identify what would have been the lives saved had these been in place, and compare it with what we have lost in order to identify the benefits. And this is what we have done in this table. Had this policy existed from 2004 to 2017, for instance, IT1, we would have saved about 34,000 lives and a 95% confidence interval between 16,000 to about 52,000. And the benefits that would have ensued had we had this policy is about 35.5 billion US dollar in 2018 figures. And this was applied across all the 4 recommended policies. In addition, what we have done is we've looked at the marginal benefits as you move from one policy to the other. Given the law of diminishing returns and how marginal benefits behave, we use that to guide the selection of the policy, because sometimes the costs are going to be really difficult to estimate retrospectively, so it's easier to use the marginal benefit analysis to guide this policy selection. So this is our proxy for selecting a policy. Based on the marginal benefit column, you could see that IT3 had the highest marginal benefits, and as such we've used this as our recommended policy in our forecast from 2019 to 2030. So based on this, we have forecasted the gains from a national policy on PM2.5 specifically from 2019 to 2030. And we've assumed that the PM2.5 exposure would reduce linearly over all these years. So it won't be overnight dropping it to the recommended policy, but it will be gradually reduced from the level at which it is today all the way until we reach the IT3 or 15 microgram per cubic meter in 2030. And the health benefits that we have estimated, the deaths averted is about 15.5 thousand lives that are saved because of the implementation of this policy. and monetized benefits of about 16 billion riyal. These are discounted to today's terms. So this puts things in perspective as to the benefits of implementing a national health or national air policy focused on PM2.5. Now, we do recognize some limitations in our study, and these are mainly attributed to insufficient data sources. For instance, what we have used in our PM2.5 exposure levels, we have used satellite-driven data averaging. So there is a large variability in this data, and it is averaged over the whole country to get one figure. So there is differences in exposure, and at the same time, using satellite data underestimates the real ground data, which has been seen in several studies as shared before. And at the same time, we've also used the VSL that is based on a road risk study, which could have underestimated the costs or benefits. And in fact, another study that was published by one of the important researchers on VSL estimated that Saudi Arabia's value of statistical life is about 4.052 million 2015 US dollar, which is about 5 times than the estimate that we have used. However, that estimate is based on a transfer value of the United States value of statistical life using the gross national income transformation. So while that figure is extremely high, we anticipate that the real VSL in Saudi Arabia lies between those two figures. And in fact, a study is required to enable decision makers to accurately have that figure in Saudi Arabia. At the same time, the integrated exposure response function that we have used, it assumes that the PM2.5 concentration is the only toxicity measure. So it doesn't adjust for the composition in Saudi Arabia, which has a lot of dust particles as opposed to chemical particles. So this difference may have underestimated the actual fatalities or mortalities associated with PM2.5 exposure. However, in the absence of a specific mortality study in Saudi Arabia and concentration response function relevant to Saudi Arabia, using this function with the assumption that the concentration is the only toxicity measure is a reasonable assumption. And there are lots of our limitations that are linked to the global burden of disease study, and they highlight those limitations in their study. So to conclude, this study is the first attempt to longitudinally quantify the lives lost from PM2.5 exposure in Saudi Arabia, and what we have estimated is about 127,000 lives that were lost from 2004 to 2017, and the costs have been in the order of 130 billion 2018 US dollars. We also identified that it is possible to forecast the health benefits based on our recommended policy, which is IT3. We've estimated that about 15,500 lives could be saved had a policy put in place with a target to approach it by 2030. The benefits that would ensue from this is about $16.2 billion. It's noteworthy to mention that in 2019, Saudi Arabia has established the Environmental Fund with an aim to achieve the National Environmental Strategy and create financial stability for national environmental centers. At the same time, it also aims to financially catalyze environmental protection plans, initiatives, and research in Saudi Arabia. So this is a move in the right direction. And also, Saudi Arabia is signatory to the United Nations Social Development Goals, which are very ambitious goals. And one of these goals, which is Goal 3, the Target 9, is to reduce mortalities from air pollution. Saudi Arabia has reiterated through its representative to the UN that it is fully committed to these goals. and it is working on it. And a lot of measures under the Vision 2030 are linked to this goal.